Okay, I'd like to just walk you through when you are about to start your venipuncture skills. We are going to make sure that you feel comfortable and are familiar with a different type of equipment that's required for the venipuncture. So here's the tray. This is what you can expect when you come in to do your venipuncture. Here's what you're going to find on the tray. You're going to find your rubber arm. Okay, it's going to have the attachment for the blood per se. You're going to find, of course, hand sanitizer, the sharps container itself. We're also looking at what are called preloaded syringes. So these are preloaded syringes with saline in them already, okay, as well as extension tubing. And the extension tubing is going to be hooked up to the angiocath, and you're going to flush the saline through the extension tubing there. Okay, all right. In this case, we're going to have you guys using the 22 gauge angiocath. Okay, and this is one that is a good size to start with. How's that? Okay, you're also going to find the tourniquet. There is a technique to tying a tourniquet. It's not as easy as it looks if it's done properly. It takes some practice and some skill. So you're going to find there'll be the tourniquet itself. Of course, the alcohol swabs. Okay, along with gauze, tape, and another type of gauze too as well, a larger type of gauze. And then finally what's called a tegaderm, okay, which is used to secure the angiocath in place. So it's one of these kind of adhesives. I'm just going to open it up here so you guys can have a look at it. Okay, because the design again too is very purposeful. So it's transparent so that you can see the site to make sure that it's not, there's no excess blood, or that when the flush of saline is given, that it is not going into the surrounding tissue. Okay, and that's just an easy peel and then apply, okay, onto that angiography site. You will also be provided with the checklist. And so there'll be a patient's name, and you'll go over the patient's name and go through all of those things that are required, right? Proper identification, etc., like that. And then what we'll do is on here, and this is what you'll be using as your guideline as far as how to do an intravenous injection. There's the patient preparation, there is the initial site selection, then we're going to talk about the preparation of the equipment. Okay, then we're going to have you perform the venipuncture itself, and then remove and secure the needles, and go from there. So it's a very step-by-step type of process that we're going to have you guys do. And again, too, it's going to be something that we want to make sure you're comfortable, you're familiar, you know what's expected, and that we can at least give you an introduction to what it's like to start an intravenous, okay? And what often when you're using these different pieces of equipment, there's a lot to be said for getting your hands on it, okay, and actually using it in the manner that it should be used rather than sort of just examining it. But we want to start you guys off slow, and we're going to make sure that, again, too, you're familiar with all of the packaging and that we follow the steps so that we reduce and minimize the amount of complications that can occur with venipunctures. Okay, good. Thank you.